Chronic obstructive pulmonary disease, COPD, and asthma are two prevalent respiratory conditions that can significantly impact one's quality of life, but each has distinct characteristics and implications. While both diseases share similar symptoms such as shortness of breath, coughing, and wheezing, COPD is usually progressive and associated with an irreversible loss of lung function, whereas asthma is often characterized by reversible airway obstruction and episodes of exacerbation. Treatments for COPD and asthma typically involve inhalers and bronchodilators to improve lung function, but COPD may also require supplemental oxygen and lifestyle changes due to its progressive nature. Risk factors for COPD include long-term smoking and exposure to harmful pollutants or fumes, while asthma is often linked to genetic factors and environmental triggers, like allergens. Understanding these nuances is vital for proper management and improving patient outcomes. Here's a detailed look at each disease's aspects. Affected tissue, alveoli versus bronchi. Chronic obstructive pulmonary disease, COPD, primarily damages the alveoli, the tiny air sacs within the lungs where gas exchange occurs. COPD leads to a breakdown in the elastic structure of the alveoli, resulting in less surface area for oxygen and carbon dioxide to be exchanged, causing breathlessness and a productive cough. In contrast, asthma primarily affects the bronchi, the main air passages to the lungs. Asthma is characterized by inflammation and constriction of these bronchial tubes, which can lead to wheezing, chest tightness, and variable episodes of airflow obstruction. Despite some overlap in symptoms, the underlying tissue affected dictates distinct approaches in management and treatment for each condition. Infection type: bacterial, viral, or fungal versus viral or bacterial. Chronic obstructive pulmonary disease, COPD, and asthma are both chronic inflammatory conditions of the airways but have distinct differences. COPD typically arises from prolonged exposure to irritating gases or particulates, leading to airflow blockage and breathing-related problems. It's generally progressive and associated with an abnormal inflammatory response. On the other hand, asthma is often linked to allergic reactions and is characterized by episodes of wheezing, chest tightness, and shortness of breath. Both conditions can be exacerbated by infections. However, COPD exacerbations are often due to bacterial infections, while asthma can be triggered by both viral and bacterial pathogens. Treatment strategies differ accordingly. COPD management emphasizes smoking cessation and inhaled corticosteroids, while asthma therapy focuses on reducing exposure to triggers and using bronchodilators and inhaled corticosteroids. Identifying the correct condition is vital since it significantly impacts management and outcome. Symptom onset: acute versus acute or chronic. When distinguishing between chronic obstructive pulmonary disease, COPD, and asthma based on symptom onset, asthma typically presents with acute episodes triggered by various factors, such as allergens, cold air, exercise. These episodes are characterized by wheezing, tightness in the chest, and shortness of breath. On the other hand, COPD, which includes chronic bronchitis and emphysema, usually manifests with chronic and progressive respiratory symptoms. Although COPD patients may experience exacerbations, their baseline involves persistent breathing difficulties, cough, and sputum production that worsen over time. Asthma symptoms can often be fully reversible with treatment, while the airflow limitation in COPD is typically only partially reversible and tends to steadily deteriorate. Typical duration: days to weeks versus days to months. Chronic obstructive pulmonary disease, COPD, and asthma are both respiratory conditions, but they differ significantly in their typical duration. Asthma is a chronic disease characterized by intermittent and reversible airway obstruction, with symptoms that can vary from days to weeks, often triggered by allergens, cold air, or exercise, and can be relatively well controlled with medication. COPD, on the other hand, is progressive and irreversible, with symptoms persisting for months or even years. It primarily affects smokers or individuals exposed to long-term air pollutants, and its management focuses on slowing disease progression and alleviating symptoms rather than reversal of the condition. Commonality of fever, often present versus less common. In differentiating chronic obstructive pulmonary disease, COPD, and asthma, a key clinical observation is the commonality of fever. Generally, fever is less common in asthma, a reversible inflammatory airway disease often triggered by allergens or exercise. Asthma flare ups rarely induce fever unless there's a concurrent respiratory infection. In contrast, individuals with COPD, a progressive lung disease characterized by airflow obstruction primarily due to smoking, may experience fever more commonly when complications such as acute exacerbations or respiratory infections occur. Notably, COPD exacerbations are often accompanied by increased coughing, changes in sputum, and can be associated with fever, underscoring the presence of infection or inflammation beyond the usual disease symptoms.